Hi everyone, the topic of my research proposal was how cognitive behavioral therapy can be an effective treatment for obsessive compulsive disorder. Obsessive compulsive disorder, or OCD, is characterized by unwanted, persistent, and intrusive thoughts that may cause those inflicted to do some action as a means to control the thoughts. Previous research has shown cognitive behavioral therapy, or CBT, to be an effective method available to treat OCD. In the proposed research study, I would use a large sample, randomization, and blinded researchers to assure validity of the findings. The objective of the present research proposal is to determine whether cognitive behavioral therapy is an effective treatment method for adults with obsessive compulsive disorder and build upon existing research. This study will attempt to limit factors that may affect the validity of the findings by 1. Using a large, diverse population that is selected by randomization, 2. Requiring participants to not be currently taking medications, 3. Blinding researchers to the hypothesis. My study participants would be a total of 350 with a primary diagnosis of obsessive compulsive disorder and who are not currently taking any medications for mental disorders. They will be selected randomly from a pool of patients across the United States who express interest via their therapists about participating in a study to determine if CBT can help their OCD. The participants will be half male and half female and fall in the age range of 18 through 65. And will be further evaluated by the sub-range age categories of 18 to 25, 26 to 40, and 41 to 65 in order to account for age-related cognitive process changes. The procedure will be a one-way experimental design with CBT as the independent variable and the OCD symptoms as the dependent variable. Participants will be assessed prior to the treatment with CBT using the Yale-Brown Obsessive-Compulsive Scale, or YBOX, which is the scale to rate the severity of OCD symptoms. It will be administered by trained clinicians who will be blinded to the purpose of the study. Treatment will consist of 3 sessions a week for 12 weeks of CBT, facilitated by the participant's own therapist. Upon completion of the 12 weeks of CBT, participants will then be assessed using the YBOX by the same trained blind clinicians as they were at baseline. Potential results is the data will be collected through the baseline and post-treatment evaluations using the YBOX. As shown by the previous research, I propose the data to show a reduced effect of OCD on most participants after treatment with CBT. In conclusion, several studies have found CBT to be an effective method for the treatment of OCD. With exposure, which is placing the client in situations that their obsessions will cause anxiety, and response prevention, which will deter the compulsive behaviors that are used to reduce or avoid the anxiety, and cognitive therapy, which is training the client to identify the anxiety-provoking thoughts and reframe them, that OCD symptoms can be greatly reduced in those suffering from it.